Spartanburg County, unfortunately, because of all the industry that we have, has a very large uninsured population. It's, for the most part, a very poorly educated population. The average age of our patient here is between 45 and 55, so they've already developed their diabetes, their hypertension, and multiple other medical problems. In recent years, we've seen a marked increase in the number of patients that have applied to St. Luke's, to the point that this year, for the first time in our almost 15-year history, we've had to cut off taking new patients temporarily because we don't have the doctors in our clinic staffing us often enough to be able to see all those patients. So we've seen a very dramatic increase in patients at St. Luke's.
Regenesis Healthcare is a federally qualified health center. We are a nonprofit corporation, one of 22 in the state of South Carolina, that has a special dispensation through federal funding to treat people that don't have health insurance. We treat people that do have health insurance, but we try to provide a medical home for those that do not, and so that care is appropriate, keep them out of emergency rooms, keep them away from the fragmented healthcare that kind of permeates America, really, and especially in Spartanburg too.
Spartanburg Regional's emergency room is the second busiest ER in the two Carolinas, yet we're not the second largest hospital. So when you look at that statistic, it is symptomatic of bigger underlying issues in our community. So we started doing an assessment of our emergency room patients to look at who are we caring for. And what we found is over the past year, 48% of our ER visits were for non-emergent care. Spartanburg Regional is the largest employer in Spartanburg County. We're the largest hospital system, and so one might think, wow, can't the hospital tackle these issues for the community? But what we found is we're only one spoke in that wheel. There are many other facets to a public health system and to an effective public health system for a community. The Road to Better Health initiative is a project that we undertook starting about a year and a half ago. We realized that there were many issues in our community, but we had never sat down as a community of public health leaders, social service leaders, civic leaders, community leaders to sit down and really get our arms around what are the problems in our community that are preventing us from being healthy. So from those initial discussions, we formed this organization called the Road to Better Health. And over the last year and a half, what we've done is spent time really trying to understand our community. We've done a lot of research. And through that research, we found that there were really four main issues that we had in this community. Access to care was one of those issues.
Oh, I think leadership is a huge key to forming a good network of providers, especially in Spartanburg County. And St. Luke's has been kind of a little bit of a cohesiveness, a little bit of a glue that has bound our medical community together. We have doctors from one hospital and from the other hospital that will work together the same night, and they might not have seen each other in 2 years because they don't go to the same hospitals. So it's been great from a community bonding standpoint, but also it's helped us draw leadership from both sides of the fence to help us out in our clinic here.
Well, it's kind of like everything else. You check your ego at the door, and if you're called upon, you serve. Leadership kind of manifests itself in a way, it kind of bubbles up, and when we find that, and it's real leadership, people willing to follow it and work with it, support it, that's what we're doing. My advice to other counties is to at least get started the way we got started. We are not completely certain where this is going to go, but we do know that the right impetus is in place. The right people are in place.
And then all of a sudden AccessHealth South Carolina is formed and reaches out to communities and says, let us help you. I mean, that's been a real blessing for us because I don't think we could, even though we've got the passion and even though we've got the commitment of our community partners, we need the technical expertise and we need additional funding to help us address some of these issues. And AccessHealth is just really the answer to our prayers.